Hello there. This is Dr. Karthikeyan again. The part two of this presentation. Yesterday we loaded the part one of blood sampling in newborns, the ways and means and ifs and buts of it. Is part two. This is about capillary blood sampling. In the first video, the link is given within this presentation as well. We had discussed about the significance and the importance of blood sampling and the lab analyzer and the minutest sample volumes, and it is going to be a nanotechnology world, so it is accuracy, precision at minute volumes, at nano volumes, correct? So now let's proceed. Sampling is an important aspect of managing preemies and sub 500 babies. I already reminded you that they have blood volume only 30 to 50 ml, and so nanotechnology in this current era should be applied to neonates as well, because more and more of tiny dots need to be made to survive by the neonatologist. Let's move on. This is about capillary blood sampling. This is a part two of the blood sampling in newborns, the ways and means and ifs and buts of it. Here is my senior colleague, Dr. Rajiv. We are in Dubai. This was in front of India House in 2019. The first slide missed Dr. Rajiv. I am introducing Professor Dr. Rajiv, who is in Dubai with us. He was formerly head of neonatology, Amrita Institute of Medical Sciences, a decade before. After that, he is in Dubai. We come to the next slide here. These are related to this biconcave disc RBCs, which carry the essential function of blood, carrying of oxygen and disposal of carbon dioxide. Next. Already this was present in the first presentation. The synopsis of these presentations, 4 in a row. Part 1 already finished. And this is the link I was talking about. Here it is, HTTPS YouTube, already uploaded on YouTube, it's available. The recorded version, here it is, HTTPS YouTube. If you just click this or search for this in my channel, all the videos are there. Now we are coming to the ways and means of sampling newborns, part 2 to part 4. Part 2, that's today's part, is capillary blood sampling, heel pricks. A heel prick is a simplified way of getting blood. These minutest volumes that are compatible with the analyzers, the auto analyzers these days, they can accept the minute samples that let out by the capillary blood samples by the heel pricks. Can't do fingerprints in newborn, like diabetes, elderly diabetes or adult diabetes, they can do fingerprints in pediatric also. These fingers are normally not used in newborn because of the size. I already told you the picture, remember that? One finger, 1.5 finger, one palm, like this only you are analyzing the sub 500 babies, sub 500 grams babies. Right, part 3 and part 4 will be about those things which are listed below. I move on now. So, importance of the blood investigations, the need of microcontamination. This was the part 1 of the presentation. I'm giving the link here. Just click it, you'll go, right? I'm not going to play this at this point. We move on to number, next slide. Here, this was the thing which was in the part 1. Now, accepted methods of blood extraction for sampling purposes in neonates. Heel pricks or cuts. Pricks are by a needle. Cuts are by a lancet. It's a lancet. It's a incision, small incision. When you want more volume of blood, say more than 1 ml in a premature baby, then you need a lancet to slice the skin. You know how to slice it by technique. Peripheral veins and peripheral arteries, either by IV cannula, IV sticks, stab and cannula will form part 3 of this presentation. UVC or UAC will form part 4. I'm going to talk about capillary blood sampling. In here, we are using this micro sampling, which offers a good alternative to venipuncture. We see here, microsampling offers good alternative to venipuncture. Most routine blood tests requiring less than 1 ml of the blood. Blood glucose and lactate analysis, blood gases, blood spot screening. These are tests which can be done routinely. Tests that cannot be blood cultures because of require absolute sterility wherever possible. When a cannula is inserted, get a blood culture at that point when there is anticipated or an existing requirement for doing a blood culture. Chromosomal analysis is not normally done in capillary blood or microsample. And coagulation studies for reasons of platelet aggregation and other reasons, coagulation studies cannot be done properly in the capillary blood samples. Now, heel stick or heel lance for blood sampling. Avoid heel prick if the prick area is edematous, infected or injured. Automated incision devices, I said the lancet, with a penetrative depth of not more than 1 millimeter. This can be even less in small babies. Should be used to obtain the blood guidelines for newborn blood spot sampling 2012. So US UK document. Here you can see this heel. This is a straight line drawn from the base of the fifth toe to the calcaneum. Another from base, middle part of the base of the great toe according to the central line of the calcaneum or the heel point. On the extreme sides of the one where you can do are permitted to do heel prick sampling without any adverse effect. If you prick at the center, calcaneum is superficial, you may land up in puncturing the calcaneal periosteum. You may end up as osteomyelitis. The case has been described. There could be other reasons also like cellulitis and infections. So stick to these sides. And in front is a no because there is plantar arch of arteries. You may puncture the arteries. And the size of the is very small. So be careful. Next. Vaseline or paraffin application makes the blood drops to stand up and fall freely without sticking to the skin. Remember not to scrap the Vaseline onto the lab containers. After taking the blood sample, don't take the Vaseline into the lab containers because breakdown of the containers have been lab analyzed. Lab is a minute sample. 1 dot of Vaseline will spoil the lab analysis itself. Use it to warm up the heels by squeeze and release rhythmically to make the heels flustered for easier sampling. It's common sense because we make the heel stand up in pink. Good pink is color. The perfusion is good, so that blood is available for sampling when you prick or the lancet. Now, we move on to next. This is a practical demonstration video.
Taking a heel blood sample. Lab tests can give us valuable information to help a sick baby. Some tests, such as hemoglobin or blood sugar, only need a small amount of blood. A heel sample is best for that. This video will show you how to take a small sample from the heel. To begin, let the mother know how this will be done. Encourage her to comfort the baby to distract him from the pain. Then gather your supplies: cotton swabs, capillary tubes, a sterile lancet or 24-gauge needle, and plasticine. Pour antiseptic on the cotton and remember your gloves. Wash your hands and put on the gloves. Flex the foot upward and hold with one hand. Clean the skin on the sides of the heel. Allow it to dry. Squeeze the heel to make it flush red. Then puncture the side of the heel firmly. Safely dispose of the sharp. Hold the tube to the blood to fill.
There is a bubble in there. It is will let out by gravity. It is will let out. You see the bubble? It will let out.
If blood is slow to come, squeeze the heel gently and intermittently.
This is without the bubble. Careful look. There's a bubble
But
in it.
not too much. That can prevent accurate results. When done, apply gentle pressure over the puncture site. Remember, use a heel sample when only a small amount of blood is needed. Use the side of the heel. Puncture firmly. If you jab too gently, you may need to jab again.
This is newborn screening, which is a technique which is
Because
commonly used
newborn
for
screening is the key to preventing disability and death for thousands of newborns every year, your role in screening is vital. This video will show you the most up-to-date instructions on how to perform that role correctly. Fill out the newborn screening specimen collection device form accurately, legibly, and completely on a clean, dry surface. Confirm that the information on the newborn's identification band matches the information on the newborn screening specimen collection device. Select the safest area for puncturing the newborn's skin. Wipe the newborn's heel with 70% isopropanol alcohol and allow it to air dry. Puncture the skin with a sterile lancet while wearing gloves. Gently wipe off the first blood drop with a sterile gauze pad. Touch the printed side of the blood collection device to the blood drop without touching the skin. Carefully fill each circle with a single application of blood to create a valid specimen. Let the specimen air dry thoroughly in a horizontal position. Place the newborn screening specimen collection device containing dried blood with closed fold-over flap in a mailing or shipping envelope and send it as soon as possible. Keep records of specimens sent, test results received, and completed follow-up actions if applicable. One problem is tissue fluid contamination. You can avoid this by not squeezing or milking the area around the puncture site.
So that's importance of capillary blood sampling. Always think of the logistics. Start from the point. Contact the lab whether the analyzer is ready, whether all the tests that you ordered for can be done, and then assemble the correct tubes for you. Bring the correct tubes, exact number of tubes you want, and then do the sampling in the way it has been described in this video. Correct. With these words, I finish this part 2 of this presentation, blood sampling of the newborn. Thank you very much. This is a monastery somewhere in Asia, I think. Please subscribe to my channel, Neoji, Heal Thy Babies, YouTube. My interest is focused on minimally surfactant therapy. There are procedure videos which are rarity. It could be very useful for you if you want to implement minimally invasive surfactant therapy. The current recommended one for delivering surfactant by the European Neonatologist Associations. So, and then here's the link for my channel. Kindly do visit my channel and subscribe. This is Dr. Karthikeyan again saying thank you. This is the end of part 2 of the presentation of blood sampling in newborn. Thank you.